things that happen now. My own mother is, well, she's 90. She spent a morning in emergency because she was having some abdominal pain. And they just eventually, I was on holidays at that point, they stuck her into a cab, sent her home by herself. Well, that would never have happened a few years ago. A 90-year-old person would be kept in until there was adequate arrangements to send them home. They would be watched for at least 24 hours to see if this problem was going to develop into anything. But I hear of these kinds of stories all the time where you go through emergency and, well, there's no beds for one thing, but you go home. We used to observe people. We used to watch for things. We used to call it, somebody came in with a bellyache and you'd kind of think appendicitis, and the term was, well, we'll sit on them for a while. I mean, which just meant observe, watch the pain, see if this is going to lead to anything, if the vital signs change, and all those things that you watch for. And very often, in fact, by the next morning, in this case, the patient was up in the OR having their appendix removed. But we took better care of people. We understood that a hospital wasn't just a place to visit quickly where a diagnosis was made and then you're shipped out on your own. It was to provide care, and there was the realistic expectation that indeed family can't always provide the kind of care or be there. People can't leave their jobs to look after a sick family member. They just realistically can't. Yeah, a lot's changed, but it's certainly the working conditions are horrendous now, but it's the care of the patients suffered just horribly. Healthcare is a corporation, even in Alberta, where we have suppostenly a good medical care system.
You just mentioned the amount of, like, the overextension of beds and all that kind of thing. And that's interesting because, I mean, certainly I've talked to people from Calgary and Edmonton and places like that, but this is also happening in the smaller centers as well.
Oh, certainly. Well, Lethbridge, as I say, was one of the few cities of its size to have two very good general hospitals. And in the outlying areas, there were the small rural hospitals, which were general hospitals. And they provided surgical care, they provided maternity care, pediatrics. More complicated things would come into Lethbridge, and then from there, still more complicated things would be sent to, or people, I say things, that sounds terrible, the issue, the illness being the thing, but they would be sent to Calgary, or in some cases Edmonton. But within a community, most illnesses, most healthcare issues were handled within the community. So they destroyed one hospital in Lethbridge, cut services drastically to, let me see, they closed the hospital in Pitcher Butte. It's just a long-term care facility now, and it's not very big. All active services in McGrath. Raymond still has a little bit, I think. Fort Macleod, which is near to the Blood Reserve and the Pegan, they pronounce that differently now. Anyway, the Pegan Reserve has no active care facility. That all comes to Lethbridge. So they've fewer beds in Lethbridge and provide far more services. And they've done that. The little rural hospitals throughout the province, they've just been decimated.